will come to order. Let me begin by apologizing to the members and particularly to our friends on the minority side of the aisle for our delay in beginning. As many of you know, we were meeting this morning with our presumptive presidential nominee, and that delayed a lot of arrivals. So thank you for your courtesy and thank you very much for your patience, and I apologize. Of course, having started late, now that we have started, I want to reiterate we'll be operating under the 5-minute rule this morning, and we'll be using the timer system from our hearings to keep track of your time. I'll probably be a little more lenient to the minority since they've been so kind to us, but if we can, let's try and move along. And let me begin by offering my opening statement, if I may. I want to welcome everyone to the Subcommittee on Labor, Health, and Human Services, Education, and Related Agencies. This morning, we'll consider a bill funding these agencies in fiscal year 2017. I'm pleased to chair the subcommittee and to provide support for important programs that touch the lives of literally every American. The bill we will consider today provides increases to advanced biomedical research, protect public health, and ensure quality education services for those most in need across our country. It does so in a fiscally responsible way by living within the agreed-upon budget caps and by eliminating low-priority or unauthorized programs in order to fund high-priority activities that benefit all Americans. The National Institutes of Health, our nation's premier biomedical research agency, is funded at $1.25 billion above last year, about $2.25 billion more than the President requested in discretionary funding. We rejected the President's proposal to cut NIH funding for $1 billion within this bill. NIH is working to find cures for Alzheimer's disease, cancer, and develop the next generation of medical treatment through the use of precision medicine techniques, and we need to continue to build upon the $2 billion increase we provided last year, not take steps backward. I understand my friends in the other body have provided a $2 billion increase for the NIH again this year. I want to be clear that I view the mark we set forth today as a floor, not as a ceiling for biomedical research funding, and I'm hopeful this number can increase as the process moves forward. The Centers for Disease Control, which protects our citizens against contagious diseases, as well as helps communities combat chronic disease like diabetes and stroke, is funded at $800 million above the request, with a priority given to heart disease, stroke, diabetes, prescription drug abuse prevention, and antibiotic-resistant programs. This bill includes $390 million in funding dedicated to the Zika response effort and another $300 million to create a new Infectious Diseases Rapid Response Reserve Fund, which will give the CDC director quick access to funding to respond to diseases like Ebola and Zika in the future without waiting for congressional supplemental process. We're all aware of the terrible toll that prescription drug and opioid abuse is taking on our nation. I'm proud to say that this bill includes $500 million for a new, first-of-its-kind comprehensive grants program to enable states, localities, and tribes to develop anti-opioid initiatives focused on prevention, education, treatment, and recovery services. Head Start receives a $142 million increase in this bill, with a special focus on early Head Start for the most vulnerable children. Preschool programs are continued at $250 million, and child care programs receive a $40 million increase. Special education programs for students with disabilities are increased by over $500 million, a 4% increase above current levels, which will help local school districts ease the financial burden of providing specialized educational services. TRIO and Gear Up, which help disadvantaged students prepare for and complete college, receive a nearly 7% increase over last year. The bill also includes $1 billion for a new student support and academic enrichment program created by the recently reauthorized education bill. These funds can be used flexibly by school districts across the country, whether the need is in the area of counseling, school climate, computer science instruction, or other special curricula. Pell Grants are increased in the bill to a maximum grant of $5,935 per student. Due to significant carryover funding in the Pell Grant program, we've been able to dedicate fewer new resources to this program in the bill this year while still maintaining this maximum grant increase. The bill also protects the most vulnerable of our nation's people by increasing funds for community services program, the low-income home energy assistance programs, Meals on Wheels, job training, and programs supporting Native Americans, veterans, and people with disabilities. It fully funds the administration's request for Native American programs ranging from education to health care to improve services for a group that has historically been America's most neglected population. The chairman's mark also includes several provisions that will prevent this administration from moving forward with various regulations that threaten to close down small businesses by imposing one-size-fits-all rules and costly mandates. The bill also demonstrates our support for the rights of all Americans, including our doctors and nurses, to be guided by their consciences in the performance of their jobs and not be forced to pay for, perform, or refer for services they find morally objectionable. And the bill protects human life by continuing long-standing prohibitions against federal tax dollars being used to pay for abortions. Finally, this bill includes a provision that ensures not one dime of federal tax dollars provided the Department of Health and Human Services through this bill can be spent to do any more work on the President's deeply flawed and unpopular health care law. I'm proud of the bill that I present today. It represents a balanced approach that will benefit every American, maintain the appropriate stewardship of taxpayer dollars we have been entrusted with as members of Congress. I now yield to my colleague for Connecticut, our ranking member, time for her opening statement.